health system to make sure you have crucial information about healthcare during the COVID-19 pandemic. Elective procedures are underway, and primary and specialty care clinics are open for in-person and virtual visits as well. This is important because annual screenings are key to finding diseases in their earliest stages. It is vital that we stay up to date on those screenings, like mammograms. So here to talk about the reopening of the Norman Regional Breast Care Center is mammography supervisor, Cindy Barghols. Thank you for being here, Cindy.
Thank you for having me.
So first of all, why are those annual mammograms so important?
Well, screening mammography, is a very important part of every woman's annual well woman maintenance program. And we've all heard the saying that early prevention is the best detection, and that is absolutely true. By the time you can feel a lump in your breast, usually the problem has been there for years. So we want to see it before we can feel it, take care of it, and that's where you get the best outcomes for breast health.
Okay, well, I mentioned before we started, my grandmother is a survivor of breast cancer. And so since it runs in my family, I've actually been getting mammograms for several years now. And you guys have a great facility, as comfortable as they possibly can be. You guys do a great job.
Thank you very much.
We know back in March that several health organizations recommended waiting on annual cancer screenings if you are otherwise healthy with no increased risk factors. Is now the time for people to start coming back in?
In our opinion, yes. Of course, we want everybody to feel comfortable about coming back in, but if you've got no reason to be at high risk, if you've not been to any of the locations that are at high risk and you are healthy, not living with an elderly person, if you feel that you're ready to get back to real life, then yes, we feel like it is time to continue with our regular health checks of every kind, including mammography for every woman over the age of 40.
Okay.
Yes.
And I know that, like you said, once people are ready, because there's still a lot of anxiety out there, still a lot of unknowns. But if someone feels like they are ready and they want to make sure they're on top of this kind of preventative healthcare, can you explain what precautions are you taking to keep patients safe at the breast care center?
Yes, it's our number one priority, of course. But we're doing all the recommended procedures. Our employees are wearing masks. We're using good hand hygiene. We're asking our patients to do the same. So we are asking them to come in with their mask. We are rearranging our waiting room to put our chairs 6 feet apart so that everybody's got their personal space. And we have a large waiting room. But if it were to get full, we will ask the patients, the women, to wait out in their car. We'll call them when it's safe to come in. I don't expect that, but we do have a plan in place for it. We are limiting the amount of wait time. So just about as soon as the paperwork is done, we're going to get you back into the rooms, get you taken care of so that you can go ahead and go. But it's our number one priority right now. We want everyone to feel comfortable with the care that they're receiving at the time of their appointment.
And for someone who's never had a mammogram, how long does the procedure usually take?
Actually back in the mammogram room, 10 minutes. Of course, there is the paperwork before. But all in all, they'll be in the office 20, 25 minutes is our goal. And we've minimized the number of slots on our schedule so that we won't have a big group of people anywhere at one time. We're going to maintain our social distancing as best as we can.
Okay. And for those who aren't quite ready to get out and about and they want to delay the screening a little bit longer, they may want to be extra diligent about breast health at home. Mm-hmm. So what are some of the symptoms of breast cancer that they should look for?
Well, of course, a lump, a thickening, a mass feeling in your breast, something that you've never noticed before. It's so important for a woman to be familiar with what kind of breast tissue that she has, because what we're looking for is changes in that breast tissue. So any new area that feels different, any skin changes, any nipple discharge of any color, any pinpoint pain. Now, if you just kind of got generalized discomfort, that's usually kind of normal part of your cycle. But if it's a specific pinpoint pain that is something new to you, that needs to be brought to the attention of your doctor. And you would do that before you actually come to see us.
As someone who's found an abnormality and had to get it checked out because, again, of my family history, I personally can't stress enough the importance of doing home self-exams in the shower, wherever you're comfortable, because you have got to familiarize yourself with what the normal is like, so you can, that which will really help identify any abnormalities.
Absolutely.
I know it can be a little, a little awkward, but it's an important part of, I think, women's health and preventing cancer for sure. So I know that. Oh, thank you. Well, I know the Breast Cancer Center isn't just for mammograms, but other people may not. So what other services are provided there?
I mean, we do the screening mammograms, the diagnostic mammograms, breast ultrasound, breast biopsies, and then also the DEXA bone density screenings. We do those as well. And
where are you located? Because you had, like many of our, I think, our healthcare facilities have moved recently. So could you tell us where you're located?
So we are on the HealthPlex campus, but we are not in the HealthPlex hospital. Our building sits just on the west side of the hospital, and the name of the building is the Women's Healthcare Plaza. So we're on the first floor of that building.
Okay. Well, thank you so much for joining us today, Cindy. This topic is near and dear to my heart. My oldest and I do the Race for the Cure every year, and I know that people can be stressed out about the pandemic and are really weighing, you know, I'll be honest, I haven't taken my kids in for their annual exams yet because we're still weighing it as well. But at least do your home self-care and know that you guys are ready if they feel that they need to come get their screening or for any other reason. So this is fantastic information. I really appreciate your time today, Cindy. Well, for all of you watching, please like and share this video so others can hear the important information, and tag anyone if you know that they specifically need to hear it. So be safe, take care of each other, and if you're getting out and about, don't forget those facial coverings. Until next time, have a great day.